Hello, I'm Dr. John Dishler, and I'm excited for you to see this program shot right here in our offices on the latest in LASIK vision correction, and it features the new MEL 80 wavefront optimized excimer laser system. This laser has been performing results beyond what we had seen with any laser before, and that's why we've chosen it for most of our patients, because quite simply I think this is the best laser in the entire world. So if you have any questions after seeing this presentation, please feel free to ask myself or a member of my staff, and we'll be more than happy to answer those for you. Thank you.
In the 1800s, Carl Zeiss built the first simple microscope, launching the most advanced lens-making company in the world today. Zeiss Precision Optics set the global standard in thousands of applications. Zeiss developments and improvements in telescope optics led the way to today's breakthroughs in correcting refractive errors in human eyes. This extraordinary technology has made Zeiss optics an essential component, integrated also into other laser vision correction systems around the world. And now, Zeiss has combined its precision optics with the latest advances in wavefront technology to create its fourth-generation excimer laser, the MEL 80, a laser vision correction system without parallel. The MEL 80 brings 160 years of the finest in lens-making technology to the challenge of perfecting the most sophisticated optical system ever created, the human eye.
As a fishing guide, we like to have some of the best equipment available, and we have binoculars that we use, and Zeiss has been one of the best optics out there for many years. And as a patient, when I had an opportunity to get my my laser surgery done, when they said that they had the Zeiss laser, I was sold, and I knew that that's the laser that I would like to have.
This advanced technology reshapes your cornea to produce high-resolution vision, unlike anything you've seen before. The Zeiss MEL 80 was not just retrofitted with new technology. Rather, it was designed around the very latest wavefront technology available. This enables your doctor to customize your cornea to your individual prescription, resulting in a more natural shape. So your vision can now be more similar to the quality of lenses on which Zeiss has built its reputation.
One of the reasons that we've been so happy with the MEL 80 is not only have we achieved excellent distance vision, many patients achieving better than 20/20 uncorrected vision, but also this laser seems to be friendly towards our patients that are 40 and above, where they not only can see well far away, but also can still see well up close, not needing reading glasses until later in life. This is something that we didn't expect. We've seen in our clinical trials in both farsightedness and nearsightedness, and has consistently proven to be true in our post-approval patients.
During clinical trials of the Zeiss MEL 80, more than 40% of patients found that their vision had improved beyond 20/20 to 20/12 or better. Almost everyone achieved 20/40 or better. These superior FDA clinical outcomes far exceeded the expectations of the vision correction community.
My vision since the surgery has been incredible. I could not see 20/20 with my glasses or with my contacts, and if I did, it was very, very rare throughout the day. And now that I've had the laser surgery with the Zeiss laser, it has been incredible. I'm 20/20 all the time. During the day, at night, it's been incredible.
I had absolutely no halos, no starbursts or anything from day one of the surgery at night. Never, not once. It just blew me away.
Some people have said with some laser surgeries there's some halos. I haven't experienced any of that at all, not at night. It's very clear. I feel much safer driving, quite honestly. And it's very comfortable. And my eyes aren't tired as they were in the past.
Your procedure will be performed on one of the most sophisticated laser correction systems ever built. What can you expect from your Zeiss procedure?
My expectation after the surgery was that I was going to have a lower prescription of contact, because I was getting to the point where I was not going to be able to wear contacts again. And so through this surgery, post-surgery, I can actually see 20/20, and not only do I not have to wear lesser contact, I don't have to wear any contacts at all, and so it's changed my life.
My expectation was definitely met and exceeded, because now I'm seeing 20/15, which I never saw that well with my contacts, ever. And I'm also able to not wear my reading glasses near as much as I was before, and that seems to be getting better over time also.
Well, I always anticipated that this is going to be fantastic, because I'm going to be able to see 20/20 without contacts, without glasses, without any of that stuff. And I knew intellectually that was going to be what it was. But when it actually happened, it was amazing. And it was pretty much immediate. I kept my eyes closed for most of that day, but the next morning I came in here and they tested my eyes, said, "Tony, you've got 20/20 vision." And that was it. It was amazing. Literally overnight.
My expectations were, okay, I think I'll be okay, same as the contacts. But when I got out of the surgery, the results were tremendous, more than I expected.
In order to understand how your vision will improve, it's important to understand a little about how our eyes work. In a normal eye, the curvature of the cornea bends light rays through the pupil and the natural lens of the eye, coming to a point of clear focus directly on the retina. Nearsighted people can see things clearly up close, but their distance vision is blurry. Nearsightedness occurs when the cornea has too steep a curvature, or the eye is too long in relation to the curvature of the cornea. Light rays, instead of focusing directly on the retina, focus in front of it. Farsighted people see better at a distance than they do close up, although they often have trouble with distance vision too. That's because the cornea doesn't bend light rays enough, so they focus behind the retina instead of directly on it. With regular astigmatism, the cornea is shaped like a football, more curved in one direction than the other. This causes the light rays to bend in such a way as to create more than one point of focus, resulting in blurry and distorted vision. Lasik reshapes the cornea to correct these refractive errors.
Patients arrive at our center approximately 1 hour prior to their treatment time. We are conveniently located in the Denver Tech Center and are a state-licensed ambulatory surgery center. Your procedure will take place during a brief outpatient visit. You'll be given a very effective numbing eye drop and possibly a mild sedative. You'll be awake during the procedure and very comfortable. Your eyelids will be held open to prevent you from blinking during the treatment. During your procedure, a corneal flap will be made with the all-laser method, and this will later protect your eye in the treated area. You'll be asked to look at a fixating light inside the laser while the MEL 80 reshapes the inner tissue of the cornea. Although it is important to look at the light, the MEL 80 uses infrared eye tracking cameras to track the eye's position to ensure exact positioning during the laser treatment. If your eye ever moves out of the treatment area, the laser pauses until the eye is realigned, making the MEL 80 one of the safest lasers available in the world. The average treatment time for most patients is about 15 seconds. This extremely fast treatment time can contribute to better outcomes and reduce patient anxiety.